Now's a good time to thank our sponsor, Survivors for Solutions. There's a lot of great things about this relationship. Like us, Survivors for Solutions wants to see continued innovation in the pharmaceutical space. They embrace the free market and believe that the free market is the best solution to improve patient lives. It was founded by our close friend CZ, or John Swartacki. CZ founded the group when he saw the damage that the Inflation Reduction Act was going to bring to the pharmaceutical ecosystem. He's been a patient, and Eric, I think you'll talk about that in a minute, but he's been a patient for several decades himself, and he wants solutions not just for himself, but for his family and friends and for Americans in the future. And he knows how important it is for continued pharmaceutical innovation to happen here in the United States, because if it doesn't, it won't happen anywhere.
Joe, you're right. CZ is a longtime friend of both of ours and a seasoned Washington pro. But what most people don't know is that John Swartacki has also suffered from multiple sclerosis for over 30 years. He was diagnosed and has required 4 different breakthrough drugs over the course of this disease in order to just live. All these drugs have been developed in a robust ecosystem of medical discovery and delivery, an ecosystem that the Inflation Reduction Act and President Biden now threaten. That threatens the hope and security and safety, the liberty, and ultimately the lives of millions of Americans suffering from chronic, debilitating, or life-threatening disease. He formed Survivors for Solutions to help save this system so others like himself have the chance at a fulfilling and robust life. You can learn more about CZ and his lifelong struggle with multiple sclerosis from our March 27th DC EKG interview, plus his website, survivorsforsolutions.org, or on Twitter @HopeMattersMost. Joe, we're really fortunate. CZ is our leader here at DC EKG, and we look forward to advocating on his behalf and the behalf of millions of American patients in the years to come on our show.
Welcome back to DC EKG. This is Joe Grogan with Eric Ueland. We're joined today by David Senior from AmerisourceBergen, who has a wealth of knowledge from his many years in the drug distribution and supply business. David's going to give us a primer on a number of interesting drug pricing and distribution issues, including drug shortages. We are part of the Bigwig Media podcast network, and we are distributed by our partner, Evergreen. Eric?
David, welcome. Thanks for being with us. We really appreciate it. You've served for over 20 plus years as a senior exec at AmerisourceBergen, a Fortune 10 supply chain and pharmaceutical distribution company. Tell us a little bit for our listeners what AmerisourceBergen actually is and does.
Yeah, thanks, Eric, for the opportunity to be here. Yes, it's a name that you stumble over. We're actually changing the name later this year to Cencora.
You're breaking news for us.
Yeah, exactly. So the new name is going to be Cencora, and so we'll be changing the stock symbol within the next couple of months. But we're a Fortune 10 company on the New York Stock Exchange. We are one of the largest pharmaceutical supply chain companies in the U.S. and in the world. If you think about what we do in terms of one of our major businesses is moving product, money, and information. So we're a wholesale distributor, which means that we're buying product from pharmaceutical manufacturers, many hundreds, if not thousands of manufacturers across the spectrum, and selling them to customers, whether it's retail pharmacies, hospitals, physician groups, long-term care, and whatnot. And so, we operate a network of warehouses and ensure that products get to those customers. We've been a significant supply chain partner for the federal government, played a key role during the pandemic. And so, big company, we touch everyone, touch everything. We see a lot of data. And, I've had the pleasure of working for the corporation for nearly 24 years.
Wow. Thanks for the explanation. I appreciate it. Folks should know that David as well was a management consultant throughout the healthcare industry prior to his time at AmerisourceBergen. And he has a degree, an advanced degree, I should say, in economics. So pretty impressive.
So let's talk a little bit about a subject that's in the news a lot, but for those of us who've been around the drug industry, it's come up at various points, and that's drug shortages. It seems like there's the perception is that there are a lot of drug shortages occurring right now. Cancer drugs and other drugs are in the news, bubbling up. Is this hyperbole? Is it anecdotal, or is there really an increase in drug shortages?
I'd say that there has been an increase in 2023 from what the drug shortages picture has looked like in the past. But I would emphasize the drug shortages are not new. This is something that's been coming for many years. Industry insiders, people who've been focused on it, recognize that drug shortages have been a situation we've faced as a country and globally for 20 years.
And why is that, David?
Well, what happens with generic drugs is, they follow a typical economic cycle. The branded product loses its exclusivity, comes off patent. A number of, whether it's 1, 2, 10 entrants come into the marketplace, the price drops, sometimes substantially. Some of those market entrants drop out because they recognize they can't compete. Price continues to drop, and eventually, there are just quality or plain economic issues that arise, and there just aren't enough buffer of producers. And so, it's hard for manufacturers to respond. In those situations, there's pressure not to raise price. Reimbursement may be, part of that pressure because, as the price drops, reimbursement gets set at those lower levels. And so, it's hard when these shortages take place for the market to really react and respond. And if you're a manufacturer, you're not sure whether to enter or re-enter a market where that takes place. And so, it's easy to have the drops, and we all get to benefit and benefit from lower prices in the generics market. But it's really hard when it drops too low for a market to be stable. And so, it's a real issue, and I think that as we headed into COVID, there were people talking about this issue. There were people thinking about it in 2019, and COVID really created a focus on demand-driven shortages as opposed to supply-driven shortages, which have been a ongoing phenomenon.
So when with your economics training and the lens that you look at this, you mentioned there's a pattern. Can you see, are there telltale signs? Is it number of entrants starting to shrink that should start to have people looking at a yellow light to say this is an area of concern? Remember when I was or is there something else? I remember when I was at FDA, we had this whole issue where heparin was getting contaminated with melamine from China. And the theory was at the time, we didn't know what was going on. And the theory was that it was a cost increase because heparin's made from the guts of pigs. It's a very laborious process to dry the biological product, the intestines from pigs in a very, it looks like a medieval process, for God's sakes, that many of us were unfamiliar with. And then they were adulterating it for economic reasons with melamine to make the sourcing readings look as if it was more a better product than it actually was. So there was economic adulteration in response to costs. And we were trying to figure out, is there a way to telegraph this for us in the future? A spike in price might lead us to a conclusion that there will be adulteration to bring costs down. How do you view it? I mean, are there any telltale signs that policymakers should be looking at to anticipate oncoming shortages? Is it a short-term warning system, or is it a long-term trend?
That's a great question, and what's interesting is that there is no, there's no simple fix for the shortage issue. But you are hitting upon one of the key aspects of a solution, which is predicting and preventing shortages. We as a large supply chain party try to do that. The government is working towards that as well. It's key for government as well as the industry to work together in terms of building supply chain maps, transparency around where products come from. I think one of the and I'll give you an example of where it gets tricky, per your comment or question. We may look and see that there are 4 or 5 finished goods manufacturers, and we're trying to figure out which one is the partner who we want to work with in the generic space. But lo and behold, we may not know that all 4 or 5 of those finished goods manufacturers are all dependent upon the same active pharmaceutical ingredient manufacturer. And so, you're right, there are ways to do it, but you have to understand the supply chain all the way up. Historically, we did think about this through the lens that you're talking about, Joe, and we thought about it both in terms of number of suppliers. To the extent that you don't have enough suppliers, that's certainly a warning sign. The risk of what we've seen is where products have gone on shortage, they do repeat themselves over time. Although many products have had shortages, whether it's weeks or months or more structurally years. But mapping that out is really key to trying to do that. And I think your point about the pricing is interesting because you can sort of think about price spikes as a symptom of a supply chain that's going to have issues, but also when prices continue to decline. People don't really think about it that way, that when the price drops too low, that's where there's really these risks. And so, I do think there are a number of parameters that can be looked at in terms of economic factors, as well as, just understanding who's in the market and how things are being produced. So within the spectrum of, the many things that need to be done to address shortages, one is this supply chain mapping and providing data and ensuring that there are government parties including the FDA understands fully what's going on, but certainly other agencies as well.
David, your observation about supply chain mapping seems to indicate backhandedly that there hasn't been good mapping in the past. So it sounds like you and many others across a lot of different industries are involved in trying to address that. One of the things that Joe and I have been talking a lot about with various experts that we spent time with here on the podcast is the role of AI and the promise and potential challenges that machine learning and those sorts of tools could bring to all sorts of public policy and business challenges. Is there a role for AI in addressing potential shortages, thinking about, predicting, trying to ameliorate or head those things off? Is it too early to come to a conclusion about what AI's role might be in addressing some of these challenges around shortages?
You're going above my level of expertise in terms of how those tools could be used. But what I'd say is the short answer is yes. But predict and prevent is only one aspect of a solution for shortages.
What are other aspects?
And to the extent everyone knows there's going to be a shortage, then you have what we term the toilet paper effect. And frankly, a lot of the shortages. A lot of the shortages we see in the marketplace are the toilet paper effect. People sense there's a shortage, and therefore, market participants hoard product. So it's a self-inflicted shortage.
Sure. So toilet paper effect actually is 2 aspects, right? Those who actually go out and do it because there is a shortage, but those who anticipate a potential shortage and go out and create the shortage. Again, without asking expertise, but if you have a longer runway, courtesy of perhaps AI and other tools, to anticipate potential challenges, whether it's production, supply, demand, what's going on with those who are consuming healthcare, is it possible that from your vantage point and the company's perspective, finding ways to ensure that much earlier, and potentially have the ability to head it off or reduce the impact of shortages might be of value for what you do and how you operate in the marketplace.
Oh, Eric, it's absolutely key. And, I don't want to diminish the importance of supply chain mapping. I brought it up as, probably the most critical thing that can be done. But, information is information. And, in terms of creating a more stable marketplace, I think you were starting to ask the question about what else is out there that should be done. And, we think there's room for advancement in manufacturing, both in terms of utilizing advanced manufacturing techniques that improve yield, lower costs, and creating a more healthy manufacturing base, geographically dispersed. AmerisourceBergen's been outspoken on coalitions about the need for incentives for American-made manufacturing. Getting the product closer to home is another aspect of solutions. And then I think the last one I guess I would mention, or maybe one of the last things I'd mention is sitting in the supply chain, we see real values to strategies that increase a buffer. It's not stockpiling in the traditional sense of static amounts in product, but dynamic with rotations. This can deal with shortages taking place, but it can also stabilize markets, similar to how I guess the Strategic Petroleum Reserve functions today in terms of stabilizing markets. So when think about that toilet paper effect, this is another aspect of many of the solutions that can take place. But there's a laundry list of things that ideas to address shortages, and we just need to get going. And I think the government is. Private industry is, we need to be working together in public-private partnerships because there is no single silver bullet that's going to solve this.
I want to talk a little bit about the onshoring idea, which a lot of people have been talking about post-COVID. But can you just flesh out a little bit about the Strategic Petroleum Reserve for pharmaceuticals, the dynamic stockpiling? So, is it for specific drugs that we know we're going to need, or is it specific drugs that we think are at risk of shortage? Are you stockpiling antibiotics? Are you stockpiling cancer drugs? That at some point, a group of David Seniors says, "Holy cow, the price is starting to drop on these drugs," or it's just gone generic. A shortage of it would be a problem. Let's make sure it's going to be we're going to have a supply. Let's have how do you figure out what goes in that dynamic stockpile?
Yeah, the general focus, whether it's us or others, are on what's called essential medicines. So these are life-sustaining drugs. The challenge is there are many different lists of essential medicines, and so how do you identify exactly the right ones? And we've got our thoughts about which are those products that intersect between being essential medicines and quote at risk. But others would come up with their own ideas about what that is. I think I alluded to Strategic Petroleum Reserve. I did some, thinking about this, in terms of going way back when to, 1970s when we had, the oil crisis, and how did we dig ourselves out as a country? And, it was a combination of tax incentives to bring production back home, as well as creating the Strategic Petroleum Reserve. Obviously pharmaceuticals are different. Products do expire. To your point, there's many products, not one. You can't just put it in a salt mine in Louisiana or Texas. You've got to keep it moving. But in terms of stabilizing markets, and this idea of A, addressing shortages that take place, but B, making sure that the market, functions as needed. Because I'll give the example. We talk about the predict and prevent. Predict and prevent is a great strategy around supply chain mapping. But when a patient needs a product today, and there happens to be a shortage of that product today, how do you draw upon excess reserves to stabilize that, and ensure that that patient gets that product?
How close are we as a country to managing a critical reserve, a stockpile like that? Or what else do we need to do to help us get to that point?
Well, I think that there are there are solutions that take place, whether it's our corporation and others who are ensuring that there's buffer of supply, but there is definitely is a role in government for creating such a supply and compensating the market for carrying the additional inventory. What I'd say is that with all of the attention these days on shortages, we would hope that if there's a drug shortage package that emerges out of Congress, that some version of a stockpiling program, dynamic stockpiling, would be part of that solution.
So we got to take a break. When we come back to DC EKG, I want to talk to you about the tax incentives that you think might be necessary to get more production here in the United States, and a little bit on the advanced manufacturing infrastructure that we might need to build in the United States. So we'll be right back with DC EKG.